Do we have a quorum?
Sorry, go ahead.
Jill, do we have a quorum?
Not quite yet. Need a couple more folks.
How many people are on this committee?
$17 now.
Wow, okay. Multiplying. All right, well, I'm gonna go ahead and get started. Jill, if you just want to let us know, or Jackie, when we get a quorum, that'd be great. Do we have any business that we need to vote on today?
No, nope.
So this is all information only?
Correct. Yes.
Okay, so quorum isn't necessary then. I'm just going to go ahead and get moving here. So this is the Incarceration Prevention and Reduction Task Force's Behavioral Health Committee. We're meeting here virtually on July 19th, 2022. And we do not have a quorum. Do you want to go ahead and start? Go ahead and start here with the land acknowledgement. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. And with that, we'll go ahead and call the meeting to order. And Jill, can you put the agenda just briefly back up on the screen for me? I just want to make sure I get the first one right. Okay, so our first order of business is Whatcom Family Community Network project to identify community resources. And here to take us through is Christy Sleddy, the executive director. Go ahead, Christy.
Thank you and good morning. It is true. My name is Christy Sleddy and I am the executive director of the Whatcom Family and Community Network. However, actually today I'm here in my role as secretariat to a grassroots effort called the Whatcom Resource Information Collaborative. And I want to apologize to Jill because she did ask me if something else needed to be on the agenda and I did not get back to her in a timely way. So I am going to, I don't see that I have a chat ability to write anything to you. So anyway, I'll just be sharing today about the Whatcom Resource Information Collaborative. And I'm going to share a slideshow and show you some links online. So let's see here. I'm going to do that and move this out of my way. All right, so the Whatcom Resource Information Collaborative, or RIC, is a community effort. It has been going on in this community since around 2019, and it has so far included about 50 individuals and 35 organizations. The Opportunity Council is a core participant, as is the Whatcom County Health Department. But there have been many others as well who have been participating in this. We are working to solve Whatcom County's need to increase access to resources. And we're doing that by creating what we hope will be an efficient system to manage resources and disseminate information and help to navigate and train people to use the system. So for those of you who have been around here for a while, you'll probably know that for about 25 years, Whatcom County has been trying to figure out a good solution to how to share and manage resources so that the citizens, the individuals who live in Whatcom County, don't feel like they're on a goose chase or looking for a needle in a haystack. And up until now, we have not found a really great solution. But we do feel like what we're offering right now is on the road toward what we're looking for. So we are currently developing what we're calling a public data utility. And what I'm showing you on the screen right now is the starburst model. And at the center is this public data utility. for all intensive purposes, it's just a database. But really, there's nothing simple about a database that will work well for us. We are working with protocol that is established by an organization called AIRS. It has to do with the taxonomy and searchability of databases. And we are in the process of learning a lot here in Whatcom County about how to do this well. So when we call it a utility, we want you to think about public utilities such as in Whatcom County, Lake Whatcom is where we pull our water from, correct? And you pull water out of the public utility. And when you get that water, you can do a variety of things with it. You can make a cup of coffee, you can take a bath, you can wash your dog, right? Like you can do different things with that water. And the idea is that there's some mechanism for you to take a public good or service and draw it towards you and then use it for your purposes. And that's really what this model is trying to show. And in the sunburst, there are a number of actions, there are a number of people, and there are a number of activities, interactions that have to go on with those people. And so I'm going to show you, let's see if I can zoom in on this part right here. And in the model, what we're looking at is we have the public utility, which is the database. Around the public utility, we have what we call a data steward. Our data steward in Whatcom County is the Opportunity Council, and its staff, specifically Heidi Knickerbocker, is the data steward hired by the Opportunity Council to curate, manage, update, and protect the public utility. And then beyond that, reaching out into a single ray of the model are what we call coordinated access points. The other term that we're using in our work for this orange dot are members. So these are social service organizations or representatives that are trusted messengers to the people who live in Whatcom County. And so the orange dot could be the health department. The orange dot could be Northwest Regional Council. The orange dot could be Boys and Girls Clubs, right? And each orange dot or member of the RIC has a primary population that they serve. Our current pilot population that we're focusing on getting all of the resources into the public utility database in first are families raising children 0 to age 8. And so in this ray, we're saying that the primary target, the primary focus population are families, and the members have an obligation to share the information from the utility with the families, with their target population, and with secondary populations that serve those families. So for our pilot population, we might think about pediatricians, for instance, being a secondary population. So the member or the coordinated access point shares the information from the utility with families, with pediatricians, and then also at least once a year, it helps the RIC analyze the data that we've collected from the utility about what people in Whatcom County are searching for, when they're getting hits showing that we have some sort of resource available. And it's also analyzing when people are searching for something and there's no information available, where they're not getting a hit or a lead on what types of resources exist, so that we can better analyze how to build our capacity to support the individuals who live here. So we're doing data collection and analysis through the utility. We have worked to include and to build into this design an equity focus. And some of the ways that we're doing that is that we want individuals in Whatcom County to be able to go to the data source, to the public utility directly without a gatekeeper, if they feel confident and competent to find the resources they need on their own. We do not want someone to have to go through an organization if they need a pair of shoes, if they need a meal, if they're looking for some sort of employment support. We want them to be able to go to the sources directly as possible to access what they need. But if they're finding they can't get their need met and they need help, that they know clearly who the coordinated access points are and which door window is going to work for them best, depending upon what their need. In terms of equity, we're also focused on trying to enter into the utility resources that are available to those populations who typically have found it difficult to gain access to resources for their racial, cultural identity needs. And so we're wanting to elevate inclusion of those types of equity focused resources above and beyond, like kind of in first priority when we know they exist. We don't want it to be an afterthought to include counseling for Black families or Spanish language resources, things like that. We have also designed and asked the Opportunity Council to design their demonstration website to include multiple languages, which I will demonstrate to you later has been done. And so we're constantly having the conversation around what does equity mean to the population being served and how can we design that into the system. And finally, at all points, we're asking the coordinated access point and the RIC to consider advocacy for the populations being served. We really want this database and this system to serve the people who live here, the beneficiaries. And our primary beneficiary are the moms, dads, grandparents, veterans, individuals who are facing poverty and homelessness and mental health needs. So we want the system to really advocate for the people who need the services and eliminate some of the runaround that they've been experiencing trying to find resources for the last 25 years here. So I'm going to stop for a second and just see what questions you have at this moment before I go on.
Committee members. Mike Parker.
Christy, thanks for this. And I figured that OC was somehow involved. It sounds like extremely centrally. So this is outstanding. We've run, of course, the Community Resource Network for a long time and tried to maintain a database. A real, one of the things for this committee that we're talking about is obviously we want to break the cycle of incarceration. We want to keep people out of there. But we recently had a conversation, Christy, and your coming to us is very timely about, well, how do we help people when they get out? And it can be very confusing to know what resources are available to somebody who's going to be exiting maybe our jail, right? And we want to get them on the right foot and know that just that web alone and that navigation and all of those pieces. Could you maybe touch, I know your example was on supporting families with children under the age of 8, and that was your pilot example. Do you think, based on what you know so far of the utility that's designed in this model, that the population that our committee is particularly interested in might be served by this, and might this be inclusive of those needs as well?
Yes, absolutely. I think what I don't know is what the timing of that is. So, but I think the answer is absolutely. I've looked at your intercept model. I think the resources that you've identified at every stage there would be included, like the majority of them would be included. The one example, I don't know whether it will or will not be right now. This process is writing inclusion and exclusion policies for the first iteration of this database. And I can see that perhaps Bible study may not be included, like a specific Bible study might not be included in this. But what would be included perhaps would be Love Inc. And so if someone was seeking faith-based resources, they might go to Love Inc. And that would be in the database, and perhaps Love Inc. then would know where to refer someone to, like a specific date and time, right, place. So I think the answer is yes. Let's just pretend for now that individuals experiencing recent incarceration and relief is population G, right? So write in basically your population here. And in time, we would build out the resource database to meet the need of that population. Some of the timeliness on that happens in work, or the prioritization of when a population will be served is based upon who the work group members are and what's kind of on their radar. So one of the things we will be inviting you to is, it would be important for you to come to membership meetings and have a voice and advocate for your population, and, you know, asking, right, well, when would this population be on, you know, be slated to get that their section of the database filled in. And it could also be helpful if there is someone on your task force that's working to build out the resources, that someone was in advance helping to gather and curate some of this information to hand it off to Heidi, so she has less to do. Like, so the quicker that we can all work together to get our information organized, the quicker it can get into the database, if that makes sense.
That does. Thanks for that.
Thank you. All right, I'm going to go ahead and move on because I know our time is limited.
Sorry, Chrissy,
So,
yeah,
yeah.
it looks like Mayor Fleetwood has hand raised.
Oh, okay, Mayor.
Oh, I did, but I can wait till the end. So this is fine. Go ahead.
Okay, thank you.
Yeah.
So we just want you to know that there is a larger vision beyond a data utility. So we are in phase 1 data utility. We're creating that, this has been created, and now we're creating policy around how, you know, what the data is, how it gets put in, all that kind of stuff. We are moving towards phase 1B, which is system navigation and resource access training, whereby we will first focus on training the staff at the coordinated access points or the membership organizations, and asking those entities to help train the people they serve. But there will also be some direct training available to the public about how to access the resources. 2 to 4 years after we're done with phase 1B, we look forward to being able to integrate with care case management tools. One of the things that has always limited Whatcom County's response to creating the system was when the data utility and the care case management system were married, where they were together, because no one organization can be served well by any one care case management tool. So we have specifically and intentionally kind of divorced the data utility from care case management tools. And what our vision is that we're creating a data utility that in the future can work with any care case management tool that wants to plug into it. So the Gelatos of the world, the Aunt Berthas of the world, the Unite Us's of the world, if they are willing to invest in writing kind of a technological bridge between our data utility and their care management tool, we will allow them that access so that they can work most efficiently from the data, from the information in our data utility. And we haven't even started to really work out all the details of that, but that is part of the vision. And in the longer term, another 5 to 10 years down the road, we hope that what we are creating will mirror or emulate a community information exchange system, such like the one that San Diego has. We know that what this is going to take is leadership. We know that this is going to take human capacity. This is not a technological solution or a technological problem. This is a human capacity issue and a human capacity solution. So we're going to have to invest as a community in the resource of someone managing this. So the data steward, Heidi Knickerbocker, a real human in real time, needs to be paid to manage this nearly full time and may need help doing that. So we are currently looking at funding and seeking funding to make sure that she is adequately staffed. The other thing that this is going to take, it's going to take community commitment. We have had a database in the past. The Opportunity Council has done their very best to provide resources. At the time, the technology was a flat FileMaker Pro system, which was really just a directory, and it was not able to be updated. And as housing and homelessness became more of an issue in the community, the human resources were pulled off of resource management and into housing and homelessness, which was definitely needed. And we are now at a point where we absolutely need to protect the time of someone doing resource management. We know that COVID has exacerbated that problem and really showed us the need for this more than ever. And then also the flooding that we had recently also showed us that we need higher levels of human coordination and communication around this issue. So that's what we're working to solve at this point. I do want you to know there is a governance model wrapped around this. The last 9 months has been spent writing a charter. The charter for the Whatcom Resource Information Collaborative was just approved by the membership in June. And at the meeting on the 15th of this month, we voted in our very first official steering committee. So there are a variety of roles in this governance process, beneficiaries being just the individuals who live within the boundaries of Whatcom County, as well as the professionals that serve them. Members are any individual representative or organization that wants to come and have a voice. There's very low barrier to membership. Come to at least one meeting a year and participate in the process, have a voice, tell us how this database should be iterative over the course of its life. We see this as a never-ending improvement project, right? We don't want it to be a once and done. We want it to be a start and an iterative process that will improve to meet the needs of the citizens here over time. There is a steering committee which provides leadership from the membership. There are work groups working on certain issues. We currently have like a budget fundraising work group, a communications and outreach work group, a data utility work group, and it's in the data utility area where we are prioritizing which populations whose data gets built out first. We're also doing things like writing policy, like inclusion and exclusion policies and procedures. There's a secretariat right now that is me. I'm being paid by the Whatcom County Health Department to do orientations and to bring people into the process and then convene the meetings and move the process forward. There's the data steward. That's the Opportunity Council, specifically Heidi Knickerbocker. And we're currently seeking a fiscal sponsor, and we have approached the United Way to do that. So those are the main roles. The charter is a long document, and before we go or afterwards, depending on what's most appropriate and possible, I can provide you a link to the charter if you'd like to look at that. So then we have the actual data utility. It's just a database. We have chosen to use open source technology for a variety of reasons. One, we do not want to be locked into any one proprietary system where we cannot make the changes that we want to make in order to serve our community. Two, there's lower cost to using open source. And three, we're working with Open Referral, which is a consultant business out of New York, who is doing this type of work all over, and they are working specifically in Washington State with our 211 systems and with Parent 123 and other communication systems. And we are working closely now with 211. For those of you who are wondering about, oh, why don't we pay for 211? Well, yes, we do. And historically, it has not served Whatcom County well. It was referring the majority of people to the Opportunity Council, to their flat directory, which had not been updated for quite some time. And individuals were just stating that it was a goose chase, and they were very displeased. So in 2017, the health department and my organization went around the county asking families what was working well, what wasn't working well. And unanimously, at almost every single turn, they just said access to resources is overwhelming. And so, it takes up so much of our time and energy. We need something better. So we worked with 211 at first. They were not at a place where they could collaborate with us to do exchange of information. but throughout this process, we are working with them to align our systems so that once our database here locally is complete, we should be able to pour our data into 211, and then 211 should be able to work for Whatcom County as well through that collaboration. And so 211 will eventually be a source of support for others, another door or window for people to go to get what they need, but they will be doing it with us, not for us. And then what I want to just, and I will show you this live, but we do have a demonstration website. And what I'd like to make clear is that the RIC is managing the public utility, the data. Then it's our community access points, or our membership, that's choosing to take the data out of the utility and put it into outward facing websites or platforms. They can do anything they want with it. It's free to our members to use as they need. They can use it internally, they can use it externally. So the Opportunity Council, through their Community Resource Center and through the Whatcom Asset-Based Building Coalition, are choosing to demonstrate that we can get the information out of the public utility into a public facing website. And currently we have this in 5 different languages. And so I'm going to stop sharing and I'm quickly going to show you the website. So let's see if I can do this. Hold on. Okay. There we go. So now you're looking at the live website. It is currently available in English, Punjabi, Russian, Spanish, Ukrainian, Vietnamese. Ukrainian was just added this week because we wanted to be responsive to the influx of refugees. So within a 1-week span of time, our membership meeting was on June 15th. That suggestion was made by members at that meeting. And now we already have at a touch of a button that we can turn the website into another language. So we're pretty excited by that. Right now, there's a fairly limited number of resources in the database. There are currently, I think, 42 organizational records and about 120 service records. But just for the sake of showing you this, you can search food. You click basic food and you ask for a search, and it shows you the organizational records for organizations that have some sort of service doing food. And there are a variety of tags, which are part of the AIRS taxonomy, and by which this can be searched. But if you're not someone who responds to words very well, and you're like, I just need some pictures, you can go to categories, and there's some pictures that say, okay, I need food, and you can just click on the icon to do the search, and it'll take you to get you the same results. So you can search by service, you can search by category or organization. And while you're in the database, if you find that information is wrong or that you're having a hard time finding something, at a click of a button, you can make a suggestion to the system for a change. It also tells you about RIC, and then it has the languages here. And so that's probably all that I have time to really share with you today. But what I want you to know is that we do orientations, hour-long orientations twice a month. If you want to go deeper or have a lot more questions, I invite you to attend one of these meetings. I do them on the first Thursdays of the month from 10 to 11 a.m. and generally on the third Fridays, although I am taking some vacation. And so the August meeting is going to be on the 24th. And so all that information is available to you on a Google Drive that is public. One of the things that we want to ensure is that this process is transparent, that is invitational, and anyone who wants a voice in it can attend the membership meetings, which happen on the third Friday of the month from 11 to 12:30, and have input into the design and creation of this. and take a level of ownership so that we create something that really works for the community. So it's 9:30.
Mayor, you had a question?
Well, I did. Christy, thank you so much. This is really great work. It's inspiring and hopeful and responsive to needs. So good job. My question, and you may have touched on this already. If you have, I apologize, but can you just state what your intentions are or expectations as it relates to support and resources from local government?
Yeah, so our 1-year operating budget is only $214,214. This is not expensive because we've done it in open source, and mostly what we're paying for are staffing. We will be seeking funding through a variety of means. It is likely that the county will see a request for funding. It's likely that we will look for funding from local philanthropy. We've already spoken to most of the foundations and have brought them in along the way, asking for their input. We anticipate that there will be gifts from Chuckanut Health Foundation and Mount Baker Foundation. They both showed interest, or we know that there are some resources there. And it is likely too that the city may see an ask sometime in the future. We're right now where we're at is that we are preparing a communication marketing piece so that we can kind of come out and do an ask, but it's not quite ready yet. It should be done by September, and we'll be getting out and asking for funds, but it's not huge funds, right? And I think that's important. And it was designed to be as low cost, but as effective as possible, because we want to sustain it for the long run.
All right, thank you.
Does that help?
It does. Thank you.
Thank you.
Ryan Estes.
Yeah, thank you, Christy. I'm very encouraged by this system. I was just curious if Crisis Connections, or the group that's running 988 now for our region, do they have access to this information?
So Volunteers of America has not been a part of this process yet, but they will be included in that, and they would have access to it. So there's no barrier to their inclusion and access.
I have a couple of questions. Actually, I'll go ahead, Mike Parker.
I already went then, so go ahead. I could wait.
So I'm curious as to the 988 rollout. I know it went live last weekend. I don't know if anyone on this call has any information as to who fields calls, and both on the dispatch side and then deployment. Then how does that work? I don't know, Christy, do you have any?
Yeah, I was actually at the behavioral health crisis team meeting yesterday, where Rena from Volunteers of America shared about that. One thing I guess I would reiterate from her is that 988 is not a new service. It is the same service that Volunteers of America has been providing from the beginning. It's just a new phone number. So that's the first thing, I guess, to know. She said it rolled out well. There was no problems. It was a very successful rollout. They only had an increase of about 50 calls since then. So really, it's just a shorter number. You don't have to look it up. You can memorize it. That's what I understand. And so it is the Volunteers of America, which is the crisis lifeline, who also is part of the regional crisis response system.
Okay. I just, I'll take just a quick minute to editorialize, and then I'll call on other members. I just think that rollout could have been broader and wider when it comes to the public for their knowledge. But it's good to know that the VOA kind of their standard process is just continued through that new phone number. Mike Parker, and then I'll call on Under Sheriff Chadwick.
Okay, my question, I think, will be quick. It's kind of a follow-up to the first one, Christy. So I was getting a sense of that the way you've designed this is that any person in need can go on there, but it's not just those. It might be a more advanced professional. So in our group, for example, we've talked about the need for navigators to help people in reentry, or to help people navigate support systems, either to stay out of jail the first time or to help them re-enter society afterwards. So could you just touch on that though? Is it real focus that this would be searchable, easy enough for any average person to use? Is
Yes.
it really more? Okay, so it
Yeah.
definitely is that, but
Yeah, so the
also
idea,
professionals could search it.
yes, the idea is the beneficiaries are both individuals in need and professionals. So if an individual in need still can't find what they need in it, then the system would know who that professional is and who that organization is and would be able to refer them to that.
And then I guess my last follow-up is, so our committee was particularly interested in kind of a curated list. Like one of the things, there can be so much information and so many resources. Is it possible in the architecture of the design of the delivery of the system that somebody re-entering, let's say they're talking to a re-entry specialist in the Whatcom County Jail, can they get kind of a curated list of these are the top resources you need, or will they have to kind of search individually based on need? I don't know if I'm making sense, but
Yeah,
like, we wanted kind of a curated list, like, hey, here's the top 20 things that would be really useful for you to know when you're re-entering.
So here is what I would say to that is I think anything is possible. Part of it would be having a voice from your perspective, advocating for your population for that to be a built-in functionality of this. So someone can be coming to the membership meetings, and as we're preparing to build out this further, ask for that.
Thank you for that.
Under Sheriff Chadwick.
Well, first, I just wanted to thank Christy. That was a great presentation, and always good to hear somebody's working on a one-stop spot for all the resources. I know our first responders often get asked about a variety of resources, and being able to point people in one spot is helpful. So as you go forward, if you want input from our behavioral health deputies who obviously point people to a lot of different resources in this committee or community, certainly reach out to them. And then the other thing, I apologize, but I have to leave and move on to another meeting. So thank you for the presentation.
Thank you. And I would welcome your behavioral health deputies to attend an orientation so they know that what's coming and, and kind of what the system is.
Thank you.
That invitation's for all of you.
Stephen Gockley.
Christy, good to see you again. Thank you for this thoughtful work and really good presentation of it. Of course, my heart goes ping when I see that peripheral circle for advocacy. But I'm not quite sure I understood how that piece fits into an information resource and what your expectations are of the connecting agencies for advocacy.
Yeah. So when we're using that term, our mind goes to the system truly meeting the needs of the individuals in need. And what we're asking for is that the representatives, the people from organizations or systems in Whatcom County who are attending membership meetings, that they come to represent the needs of the populations they're serving. Those individuals could also, individuals from the community could technically come to membership meetings. And early on, our conversation was, how do we hear the voice of the people, the users? Like, how do we get the user experience, right? And so one of the work groups is planning on, so as we're, we haven't made the database public yet, right? So we're really just developing this, like we're on the verge of making it public, but it's a little bit, the pro is that if we make it public, people will start to learn about it. The con is that not all the information's in it yet, right? And so there will be a limited set of things that people can find. And we don't want to disappoint and create a lack of trust, but at the same time, we want to make available what is available as soon as possible. So in terms of advocacy, though, the bigger picture is that this system should never go stale. We should constantly be iterating it for the needs of the public. So one of the examples was someone in the membership meeting said, hey, we have a huge influx of Ukrainian folks coming to our community right now. Can we add the Ukrainian language? That was advocacy. Someone advocated for the needs of refugees, and within a week, the system was able to respond to that advocacy need. And that's the spirit of which we are holding around that concept of advocacy. Let's hear what the people need and let's iterate the process and the system to get their needs met. Does that, I mean, it's general and specific.
Yeah, that gives me a sense, especially the internal focus. I was thinking, and maybe down the line, you'll be thinking also, we're dealing with systems that haven't served optimally.
Yes.
You know, racial equity is
Yep.
the biggest piece of that. So
Yep.
it's not solely an internal discussion to get Ukrainian added to the website. It's how do you move systems that don't move and don't want to move.
Yeah. So
that's the piece of advocacy I was thinking about.
Gotcha. So one of the things we're hoping to do by creating the system the way it's been created is that each of the orange dots in the model, which are the members or the community, the organizations that are serving people, we're wanting to bring them closer together. And the monthly meetings are meant to be a space where we are educating one another on the systems and that we're moving our community forward in a mindset around how to really elevate equity, support people, and make a system like this work. And so there is a community change element through the membership engagement and that commitment we're asking from the community to participate. Don't just put the weight of this on a single organization and walk away from it and say good luck. We all need to be working together.
Thank you.
Committee members, any other questions for Christy? Okay. Courtney Taylor, are you at your desk? Can you?
I am.
I have a question for you.
Sure.
How do you see your clients utilizing this system or benefiting from it?
I think the biggest thing that I see as a benefit is what Christy's talking about with, you know, what users of the services are actually experiencing versus what the agencies think they're providing in terms of services. I think we have that a lot where across the board client experience does not align with not just what individual providers think they're providing, but agencies as a whole and communities as a whole. I think this will help with the siloing.
That's exactly the intent. We do not want to see a family with, you know, 2 children with high behavioral health needs or fragile medical needs having to call a list of 30 places because somebody thought they did their job by handing them a call list. Like, that's not adequate.
Right. Yeah. And not accessible and not, I mean, we want to talk about inequitable systems, not as that we're making a lot of assumptions about ability, disability, literacy, just so many things when we hand someone a list.
Yep.
It's not effective. Like, we can all do better jobs of explaining things to people that seem so simple to us, but make a world of difference.
Right.
Okay. Other committee members?
I guess
Okay.
just one last one. You mentioned that it's going to have resources available, and you mentioned something I thought I maybe heard client information. Is this no? So this is really going to be about resources available to help anybody in need in any given subject area, but it's not going to be a repository for any kind of service data. Is that correct?
That is correct. I could imagine that in the future, when we look at the care case management aspect down the road, right, that at that point is when we start to get into client information that's been chosen by the client and with confidentiality releases to do a bidirectional referral, things like that. But there will be a whole other lots of other conversation and process before that happens, but not today. The database is pretty simple in concept. It's like, let's get all of our information about resources into a single repository that has an update schedule, right? And that they've all been vetted so we know the information is accurate.
Yeah, you'd say simple, and yet you're doing a Herculean effort. So thank you for doing that. What sometimes seems simple is not. And so I really appreciate the work in your presentation today.
Thank you. Thanks for having me today.
Stephen?
Christy, would you send your PowerPoint presentation to Jill Nixon so that she can distribute it to us?
Absolutely.
Thank you.
Thank you.
Okay, further questions? Okay, seeing none. Christy, thank you so much for the presentation today.
You're
Appreciate your time, and just thank you for all the work.
Thank you very much.
Okay. We will be, let's see, just a second here. We're moving on to our next agenda item. This is a draft updated sequential intercept model service inventory for the Justice Project. And here to take us through are Mike Parker and Jackie Mitchell.
Jackie, of course, as usual, has all the brains and all the particulars. I just wanted to say a couple things. First of all, Jackie, thank you for attending the meeting. Second, to our committee members, why we put this on the agenda. So as you know, the SIM kind of got a lot of updates and a lot of input from the Incarceration Prevention Task Force. Specifically, the Behavioral Health Subcommittee was quite active and vociferous in making sure that both needs that weren't being met were put on this inventory back in, I believe, 2019. Jackie will tell me if I'm wrong. But not just needs, but actual services that were in the community and things that we were advocating for. So as part of the Justice Project and the stakeholder advisory group, right, and our work in the Incarceration Prevention Task Force aligned closely with that group, a BGAT was created, Behavioral Health Gap Analysis Team. And this essentially is designed to look at the SIM, to make recommendations and improvements and enhancements to the SIM. But not only that, to also then look at where the gaps are and then to make some suggestions about how the community might move forward on actually closing those gaps. This includes some estimates of what it might take to lift a program up. So we're talking the funding, the finances. It's just such important and seminal work. And because it kind of in some ways started here, coming back here to see how they've tricked out our car, I think was one of my hopes and dreams. The second, they've made a very curated and targeted list. There are so many wish list items on the SIM for our community to help people with behavioral health challenges stay out of jail, or if they're in jail, reintegrate in the community safely and quickly and not go back, right? So, but what they've done is they've sifted through and they've attached some priority to things. So I think there's a lot of value add in what Jackie's going to cover with us today, especially that the needs and recommendations are kind of like, there might be 20 things. They probably picked the top 3 or 4 and said, based on our surveys and our subject matter expertise, we think the community should invest in these. And it's a very powerful list. So I would just mention, I sat, and I know some of you were at the Stakeholder Advisory Committee, some of this may seem the same, but we wanted it to come back to the Behavioral Health Subcommittee to tell us what's good, what did we miss? Do you agree with the prioritization? Because what Jackie will really focus on today is not the entire SIM, anybody can read that, but on the curated list, which I think could be the beginnings of what we might take to voters in a package, right? Or what we might take to our community members and say, this, we need to go. So I'm going to stop there. And Jackie, please correct if I'm wrong on anything. And hopefully that framework can kind of help set a tone for what we want out of committee members. And please interact with it today. I know we have a small attendance too, so we'll make sure that we go to people on email because we want that input from committee members into this process. Jackie, with that, I'm going to stop talking and thank you again for being here.
Oh, thank you, Mike. Jackie Mitchell, Behavioral Health Program Specialist with Whatcom County. And Mike is always so generous with the compliments. But he was also on the team, so he was a part of the work that we did. And I didn't know today if we should go over the SIM, because I mean, the original sequential intercept model gap analysis occurred on the Behavioral Health Committee in 2019 and was updated again in 2020. But I see that we have some new members. And so I just didn't know if it was worth doing a quick overview of the sequential intercept model itself, or if people feel like they sort of have that already in hand. Sounds like, Brian, you think you've got it pretty well. Brian, I think you're new. you feel a need to go have a quick overview? I mean, it's great. It's fine to do that. Okay, great. Okay.
No, I spent time in advance. Thank you.
Okay, great, great. Thank you. So we'll skip that part. And let me just move down my list because I didn't know where we would need to start. So as Mike mentioned, we did utilize what the work that the Behavioral Health Committee started and updated again in 2020, and in analyzing the gaps in the community. And this is a criminal legal / behavioral health interface. So for people getting into or possibly entering the criminal legal system. So I think we can move on, Jackie, to the second document that you've got. If you want to show that, is Jackie there? Jill?
Sorry,
perhaps?
are you wanting us to screen share, Jackie?
Oh, no, I thought you were going to show the second document. Sorry.
I can give you co-host so you can screen share, or I can put the packet from today's meeting up.
Yeah, put the packet up and move it down to the last, the second document in
Sure.
the gap analysis. Thank you.
This might be the old version. 1 second. Yeah, this is the old version. I'm sorry, Jackie. Give me a second to open it.
Okay, great, thanks. So anyway, just to go ahead and talk here, when the second document comes up, it's essentially the needs and gaps and a prioritization or a priority list of those needs and gaps. So we went through as a team. The team consisted of subject matter experts in behavioral health and housing in particular.
Is this what you're looking for, Jackie?
I think it's up a little bit further on that particular document. Oh, no, that's the same thing.
I think I have it, Jill, if you want to give me
Okay.
screen share.
So this was a request made by Council Member Barry Buchanan of the Health Department for us to update and do a gaps analysis update of the sequential intercept model. And so we called together mostly an internal team, but Mike Parker was on it as well. And like I said, there were subject matter experts in behavioral health and housing, as well as from our first responder systems. And then Perry and myself, and then Marty Solomon was on it, and she's essentially the liaison to the Stakeholder Advisory Committee, which is whom we were tasked with presenting to in mid-July. So our work, we did it at a sort of, that's it, thank you. We did it and you can go on down to the table. Actually, go back up to the first page, thank you. So we did our work at sort of a feverish pitch over about a 2.5 month period. And again, so that we could conduct a presentation for the Stakeholder Advisory Committee on, I think it was July 14th. And staying true to our mission to prioritize the gap analysis work that we did, we developed a 1, 2, 3 prioritization list. So we had our first priorities, second and third, and these were based on a couple of parameters. One was those services having the most impact and effect on shortening the days in jail for people with behavioral health issues. And the other one was thinking about the task force's work, that they would continue to make headway in developing additional services that would prevent and divert people from the behavioral health service system. And we split those up into 4 different groups for this presentation: community behavioral health systems, housing services for at-risk populations, and jail behavioral health services, and reentry services, or transition into the community for those people who are hopefully in a way that would keep people from ending up back in the system. And so go ahead to the second page. So I'll just kind of overview this. I don't want to go through each one, but the needs and gaps that we put in the first priority for, and keeping in mind that there are second and third tier priorities still. But with the short time frame that we had, we could only do the first priorities. So in this first couple of categories, you'll see that we thought that on-demand assessment for substance use disorders and mental health disorders was imperative, as well as treatment. And if you'll go to the second page, please. And then we also felt that reducing the amount of time that law enforcement was spending in dealing with people involved in or needing involuntary treatment services was important. And so then you see the solutions, the needs, the need and the gap, and then the recommendation, and then the intended outcomes. And then that last category there of estimates of resources needed to implement recommendations is, I think, a body of work that's still in process. So then the second area was housing services for at-risk populations. And both the, I think, number 4, and if you can go to the next page, there's a lot of, we noticed a huge lack of both scattered site and permanent supportive housing. And in addition, we noticed that we didn't have much in the way of clinical or behavioral health services to help support people that were in these housing programs. And this came out as a high priority need to help stabilize people in the community so that they either don't end up in the criminal legal system or so that they're stabilized after or upon re-entry. We also had a call for dedicated housing for people in therapeutic courts like drug court and mental health court programs. And if you'll go to the next one. We were again running out of time, and we spent the bulk of our time trying to make recommendations in this area of the jail behavioral health services. And there was an obvious need for more mental health professionals or intensive case managers in the jail to help with keeping people stabilized and then getting them out into whatever services they needed as quickly as possible. And then the next one, please. And again, that need for on-demand mental health and substance use disorder assessments. There's nothing like having an MHP or an SUDP at the jail who can both build a relationship with people who are incarcerated in the jail and can respond very quickly to a need when there's a need for an assessment. On the mental health side, we also noticed that there was a lack of what we call Medicaid ready assessments, or assessments that would allow a person to go directly from the jail into a Medicaid program. We do a behavioral health assessment in the jail, but it doesn't have all of the accompanying supplemental paperwork to be considered a Medicaid ready assessment. And then again, that's just kind of going through that we saw a need for evidence-based services, in particular substance use disorder services and psychoeducational groups that might be dedicated to helping people understand their addiction, their substance use disorder, and how their brain is interacting with the substances they're using. So, and other kinds of groups as well. Go ahead. I think this is the last area, which was re-entry services. And I think this is widely known that there's not enough re-entry. We only have one re-entry person on the behavioral health team at the jail. And certainly the numbers that the jail has shown with regard to the number of people with behavioral health issues would support at least this many case managers on the re-entry side. So, and then we had, I think the last thing to mention, and you can go to that next page. The last thing to mention, oh, sorry, I forgot about this one. One last program that we talked about was the need for more program for assertive community treatment, which is a best practice intensive case management program, usually dedicated to people with serious mental illnesses. There are, however, adaptations to the PAC program that we might be able to use for other populations releasing from the jail with behavioral health disorders that are not related to serious mental illnesses. And then the last page.
That is the last page I have.
Oh, okay. You had shown, I think it must be on the other one, but that's okay. You don't need to show it. There was a couple of groups of topics that came out of the gap analysis. Yeah, towards the end there, that we put in what we call the addendum. And that's because they were seen as either policy issues that needed to be addressed at the state level, maybe laws that needed to be changed, or they are local systems coordination issues that need to be addressed here locally. And so that's what you see on that last page there. And I think, so that's pretty much the work that we did. And again, we had a very fast timeline. So I think we did a ton of work in a very short period of time. And our next steps are, I believe it's to continue developing some of those areas that you saw in gray on the previous document, where we are trying to figure out the cost of various areas in the priority list. And I think that's it. You have any questions on the gap analysis work that we did?
Parker?
First of all, thank you for that. I've seen it a couple times, but it does help. There's a lot of information in here and a lot of work, both just the prioritization work that led you here, but then also looking at what you put in the chart in terms of what do we expect from this? And I think this is really important too. But how are we going to bend the arc of number of people in jail? What is the expected outcome of this investment? And I think that is a step forward that really the task force hasn't really done or taken to that level of analysis. One question for you, there's a lot of areas, I think, both inside jail facilities, inside public defender's office, inside maybe DOC, where investments could be made in like navigation assistance, advocacy for people going through our criminal legal system. And your chart of recommendations contains those. And I guess I'm just curious in terms of coordinating, thinking, aligning. Some people argue that we really should be having these things done by outside organizations outside of the jail. Maybe they visit and they do work inside the jail. Or is it better to have them be jail employees or through a contract through the health department actually be stationed in the jail? So I guess my question to you is, with our talk of navigation, right, and needed in all these different phases, what's your thinking about that? How should our committee members think about that? And I guess what did your group think kind of makes the most sense to help people navigate through this?
Yeah, Mike, that's such a good question. I think we talked about it. I think there's a perception that having services in the community but not at the jail is really the best of all the alternatives. It is my perception that having access to professionals in the jail is really critical to being able to engage people with behavioral health issues, build relationships, and get them out of jail into services that they need. And so having both is really ideal to me, but having services that are based at the jail is, I think, critical to getting people engaged and moving them on into the system, into the community. So this term called community-based or jail-based, for one thing, I think I want to also add that, for example, the behavioral health and reentry services program that we have now at the jail is run by Lifeline Connections, which is a community agency. So there's oftentimes a perception that those services are run by the jail, but they're not. They're administered by us at the health department, and then they are provided through a community agency to the host, which is the jail, and also to juvenile detention. So I think it's really important to have those services, like I said, in-house in order to be able to connect with people. And Brian, you have a question or a comment?
Yes, I'm relatively new to this group, and I guess one of my kind of big picture questions is, since this is the Incarceration Prevention and Reduction Task Force, and it's reducing the jail population over what time period? And so I see some of the rankings for funding, particularly related to youth, that are not, as high as maybe they could be or should be. And I'm just seeing that this is largely a response, kind of model for people who have touched the criminal justice system in some cases. So for example, like the prioritization of under intercept 0, student assistant programs is number 3, and then under unmet needs, youth street outreach, services for youth are priority 2. It just seems to me, if we're really going to address prevention, in a more substantive way, that we really have to put more resources into, youth, troubled youth, and so that they don't ever touch the criminal justice system. That's true prevention. And so I guess my just general feedback is the overall priority, perhaps as it should be, but is for people who have already been touched by the criminal justice system. It just seems like there are opportunities here. And I'm talking, 5, 10, 15 years. If we're not really having a robust prevention system, then we're perpetuating, this system will just continue. And so that's just feedback kind of in general. And I also think NAMI should be listed as an organization in Intercept 0 and Intercept 5, because we do, have programs for both people experiencing behavioral health and people who support them in both. We have a number of people that have come out, from the jail and are referred to our programs, and they're very helpful. So I don't have a specific suggestions here, but I'm just throwing that out in terms of some of the prioritization in terms of funding. Housing is very important, super expensive, but I think when you look at the cost effectiveness over time of a number of preventative programs, they're extremely cost effective. So that's my question and kind of comment.
Jackie, can I respond to that?
Oh, sure, Dan.
Brian, you're spot on. Investments in children and young adults, teenagers are less expensive, and they're more effective than trying to fix people once they're in the system. That's just reality. There are several members of this group and people that are not here today, including Heather Flaherty, who have championed that cause since the beginning, basically the beginning of the Incarceration Prevention and Reduction Task Force. I'm looking at you, Stephen Gockley, as one of the people. Byron Mannering was also a champion on that, and several others, Parker and others, including myself. We're seeing the value of making those investments. The task force deals with adults. It does not deal with kids, and I think that's to a fault, unfortunately. But I think that we cannot do everything. We just cannot. We can't solve all of society's issues. So to address your point, the group that was led by Generations Forward and Chuckanut Health Foundation and others has been working on a children's initiative for years. We attended a conference in Denver in 2018, I believe. So 4 years ago, we were, ready to go. And then COVID hit shortly thereafter, and everything got put on hold. However, there is a children's initiative on the ballot this November, and making those investments in kids early, birth to 3, quality childcare. Those are things that make a long-term generational difference. So I hear you loud and clear, Brian, and others do, and support that work. But it has to be sort of a parallel track, unfortunately, because of the parameters of the charter that defines this group. So I hope that gives you
if the charter is adults, then I totally understand this. So, but thanks for that. That just puts it in perspective.
Thank you. I also want to add to what Dan said, Brian, in that I think, first of all, our mission was to help the SAC, which is the right size jail group. So I think, and because of the timeline, we had to hurry and put our stuff together quickly and get it done. But I do agree with you. And also, I like to remind people that adults in the jail have children. And so reaching them is part of dealing with what we call family systems issues and sort of interrupting the cycle of criminal justice interactions. So it's not all's not lost is all I'm trying to say. And yet I do agree with you as well.
And I would just add one thing, that it's concurrency, right? So we have to do both. We have to look at investing in kids, but we also have adults that are in the system, and we need to deal with both. I hate to say walking and chewing gum at the same time, but it is kind of along those lines of having to do two things at once. It's a heavy lift. So Courtney, you've been had your hand up for a while.
Ooh, yeah, I've just been like on pins and needles listening to this because basically what Jackie said a while ago, we need both. It is a complicated issue. And our clients that are adults are worth investing in. This cycle continues to repeat itself because I might lose some of you here, but we view care from a very capitalist mindset, and we cannot view it from only an individual perspective. Like Jackie said, these adults have children, they have families, they have people they're connected to. They are worth investing in. Making sure they get treatment, adequate treatment in a timely manner is part of preventing this cycle. And I guess returning to the conversation about who we need and where we need them. We need more people in the jail. We only have one MHP right now, one prescriber. It's not acceptable for someone to sit in psychosis for 6 weeks waiting for medication. We also need more community behavioral health agencies that are willing to provide clinicians who will go into these facilities and do these assessments, so that we're not relying only on lifeline connections for those in jail relationships. We need both. We need people in jail. We need community providers out of the jail. It's definitely not a black and white issue, but we also have to, I think a lot of these community conversations we're having around who needs what, we're so used to being in this scarcity mindset and fighting over resources. And part of this task force is, it should be changing attitudes too. And we have to remember that it's not just kids, adults in jail who are disabled, who are sick, who are racking up points, who are looking at hard prison time. They are worth investing in just as much as a child.
Courtney, I want to respond to that, but I'm going to go to Stephen. So this task force and this group in particular has been working quite a bit with the SAC, the Stakeholder Advisory Committee for the jail initiative, basically. Courtney, I think that your voice is really important when it comes to communicating out to voters what you think and what people within the system see on a daily basis when it comes to interventions, like you said, for investments in people and working towards behavioral health solutions, so that people don't reoffend and that they are able to get out and be a parent or be employed. So I'm hoping that you will attend future when we combine the task force or this committee with the SAC. I'm hoping that you'll be in attendance, because I think those ideas are critical.
Yeah, I would love that. Since my supervisor will be in that meeting as well, I'll probably defer to her to speak from our office, but I'll definitely chime in where I can, just on those joint meetings. We have multiple folks from our office participating, but yeah, I love these conversations. This task force is doing the work. We have a long way to go, and as long as we keep everyone on the same page and knowing it's not a black and white issue, I think we're doing good work.
I think having a joint meeting with our committee and Public Defender's Office and SAC is kind of the next step. We've had prosecutors, we've had jail chief, we've had several others, but I think public defender is critical.
Yeah, and to speak to the since you're all part of the coordinating with those meetings too, I think from our office, like something that I often hear is that we need more participation from the prosecuting attorney's office in a way that is kind of like, who said it earlier? I think it was Stephen Gockley, systems that have a hard time changing. I think that that is an area that could be a little more flexible.
And with that, Stephen?
Thanks, Dan. I thought Courtney might be ready to make this point. I was going to applaud, but she went in another direction. So I'm going to reinforce something that she has said in past meetings. And it just occurred to me looking at the chart, Jackie, that you went through, where we divided up community-based mental health services and jail-based mental health services. And from my experience working with people who often ended up in jail part-time, they were usually very disaffected from community-based mental health services. They hadn't found that effective or humane or sympathetic. They didn't see those people as allies. Whether or not it's lifeline services coming from the community on a contract or not, jail-based services are a them to a lot of people with mental health and substance use disorder problem. So Courtney's mentioned before the efforts by the Public Defender's Office to beef up their behavioral health specialist resources. And it seems to me that that's the natural ally to someone in the jail in terms of getting some traction on a treatment arc for individuals. And so I think maybe we're missing something when we divide it into community-based or meaning agencies or jail-based. And I just think that might be an opportunity for us to strengthen the partnership that public defenders already have with their clients and get things moving while they're in jail. I agree that's not the whole answer, but it is the beginning of an answer, and it can point towards success or failure depending on how well it's done. So I just want to say, I'm not sure how we'll fit that in at this late date in the conversation, but that ought to be something that either in the SIM or in the task force in subsequent recommendations coming out of there, we give a little more thought to, maybe have a little more conversation about.
Yeah, I can mention that and bring it up with Perry when he gets back from vacation. But I think where Perry left this with me was that the BGAT team is finished with their work essentially. And so I think the job of this committee is to determine if you want to accept this work as sort of something that you want to adapt, accept and then adapt, or accept as it is. And if you want to update the gap analysis further, I think it would be incumbent on this committee to decide how to do that, or on the task force. But basically, the BGAT team isn't really meeting anymore. A few of us are still meeting to finish out some stuff for the SAC, but that's about it. Does that make sense?
Yeah, that does make sense. And we've also talked about the SIM update being a living document that we keep working on. So I wasn't necessarily urging gathering the BGAT again to make changes that I was proposing. But just that as we think about, is this what we want, or do we want to tweak it a little bit, or do we want to tweak it down the road? That would be a place I would look.
Yeah, I think both your comments are important. I don't know how we missed putting NAMI on there either. So in the zero intercept. So those are a couple of important ideas, both of them that you've brought up.
And I would just say, Dan, really quick, that this is kind of one of the purposes, right? Like we want an opportunity for this group to provide some feedback and to interact with it a little bit, and then to see what pieces of it seem to make sense and align with what our recommendations might be. The subcommittees made recommendations to the task force as a whole, and even to the county council in form of a letter about recommendations about how to allocate the community's ARPA money. So I think, this kind of framework that we're being presented with by the BGAT group, we could make it ours, take it, and then do something with it. And so my hope is that members are critical, interact with it, and like some things, don't like something, maybe we tweak it, but that maybe it can be a framework to try to advance some of these much needed added services in our community.
I agree that it shouldn't just end there in terms of the work that the group did. We should, bounce that out up to the county council. And I totally agree. The ARPA funds are there. We could be utilizing this information in a much greater way. I'm going to return to that, but I wanted to recognize Courtney.
Oh, I was just gonna chime in and just say nothing for sure yet. But we are advocating internally for more behavioral health specialists like me and Nathan. So fingers crossed we have more coming. But also just as a reminder, I can only work with people once they have charges. So the goal is that we have people on the other end of the SIM so that hopefully, theoretically, I never have the opportunity to meet them, right? Because they're not getting cases or more cases. So we do need more of me and Nathan, but we also need way more people in the jail because we have folks that they need treatment.
Okay. Brian?
Yeah, I just had a quick question. My understanding is the Health Department's response division, they're going to operate a facility next year. It might be just day use, but is that shown here in this chart anywhere?
Yeah. So yeah, I'm not sure if it's going to house specific programs. That was what I think the original intent was, to house like the alternative response and the co-responders, so that they're near the crisis stabilization facility. So those programs are shown, and the crisis stabilization is definitely on the list, both in the gap analysis and I think it's also in the policy area or the system coordination area. So so in a way, yes, but the facility itself, no, we weren't really looking at facilities so much. Does that answer your question, Brian?
I think so. All right, yeah, should be a separate conversation. So, all right, thank you.
Yeah. So the response system division is rolling out the alternative response program and the co-responder program, which I believe are going to be at the facility, but I'm not sure. I'm not sure what the final plan has been on that.
Jackie, are you talking about the Division Street?
Yeah, yeah, the facility that we just left to put the services in the new crisis stabilization facility, the old facility on Division Street.
So are you saying that the alternate response team and the co-responder will be housed potentially?
So I'm not positive about that. Why don't I check and get back to you on what the latest plan for that facility was? I'm not really sure.
Okay, that would be good. I think we need some clarity on that one.
That's what I thought, but let me get clarity before anybody jumps on it.
Okay. All right. I want to manage our time here. We're running out of time here. And I want to circle back to Mike Parker's thoughts on how to use the gap analysis and how we should talk about that and what the recommendations could be. And I think that's going to be a future meeting. Go ahead, Mike.
Okay, I was actually, I was gonna call on, if I could, Brian Dane briefly. Thank you for being here, being in attendance. There's a couple of recommendations on this particular list that Jackie went over today. You can see there's quite a housing focus. A couple of key areas, a lot of them are kind of services for folks with serious mental illness. As the largest housing provider in Whatcom County and maybe a key, ally to some future programs. I know there's been some talk about shelter plus care utilization, which is a grant program we already run, but I'm thinking like mainstream vouchers. Could there be ways to maybe ally some of these housing needs for folks with some clinical needs with housing authority programs? And would you just comment too, just from your knowledge and standpoint, are we hitting the mark with some of these needs, do you think, for offenders that you see in vis-a-vis housing? Or what would you add or what would you take out? If I could invite you and / cajole you, what do you think?
I would not add or take anything out. from our perspective, I think the key is on the case management and clinical support end. Simply providing a living space is not adequate for too many people. And I don't want to use the term enjoyed. I've appreciated the discussions about the shortcomings and dysfunction of our behavioral health system, where we too often take young people, traumatize them with little support as case managers, and they either burn out or decide to go elsewhere. And it doesn't work to bring people into affordable housing properties without sufficient support. It feels a bit chicken and egg to me. It's also challenging that just as much as it may seem like the resources for developing and acquiring more housing are growing, the costs and challenges are growing at least as quickly. So
it sounds like the focus though, Brian, from you on services, on clinically focused services that could help bolster people in housing, kind of meets what you're seeing for folks in some of your housing units and what you see for the population. Did I kind of glean that right? Okay. Because I think it's very heavy on that. You know, obviously they need bricks and mortar places to be as well, but I think the Begat team really focused on those services. Dan, with that, I'll stop, and then I'm not sure what else. And I see Courtney's hand back up.
Go ahead, Courtney.
I was just gonna say, agreeing with Brian or Brian, if I'm pronouncing that right. The most of the feedback I hear from my attorneys is they struggle with, you know, I don't know, I don't have a place to connect my client to. We have all these programs or resources for bridging services, but if we don't have somewhere for that person to go for actual services outside of that housing, outside of that kind of bridged intensive case management, if we don't have actual therapy, you know, just using an example like client X, if he's not getting therapy for the delusions that are causing so much distress in his life, that he's not able to maintain his affordable housing. I mean, the domino effect, that cycle, that trauma that Brian was mentioning. Yeah, we need more than case management and bridge services. We need places that people can go to. And that's what my attorneys hit the most as well. Just trying to navigate this system from the outside.
Okay, folks, we've got just a couple minutes left here. I see no attendees, so I don't think we need to do public comment. Jill, correct me if I'm wrong on that. But I do want to just try to squeeze in a little bit of business content here for our next meeting. So there's so much information that was just put out. I want to make sure that we cover it and that we utilize it. Mike, do you have thoughts on moving forward on how that looks from your perspective?
Well, this could look a couple of different ways depending on what committee, and this probably needs to go to steering too, if Stephen agrees. But my thought is, you know, we kind of gave this football right to the Begat team, with kind of turbocharged it, put a lot of recommendations on it. And that could come as part of a jail initiative. It could also come separately and complementary aligned as task force work. So we could agree to take on, and by take on, I mean advocate. We do the work of a committee that doesn't have employees, but we push for things, we work to make things come to fruition that are aligned with our goals. it seems to me that there's a lot of substance here, which could be possibly either partially or wholly adopted by the task force and or the behavioral subcommittee, and at least in a champion advocacy standpoint, so the good ideas don't die. So my thought, Dan, was to bring this kind of back as the behavioral subcommittee kind of put a lot of work into the first sim. Hey, here's this thing coming back to you. Have members have a chance to see it, interact with it, and then be in critique it too. Do you agree with, for example, the ranking of what was the most important if we're talking about investments in new services? I mean, I think there's a lot of knowledge on our group, Dan, and to try to get that feedback, knowing and being very conscious of how much volume of it information it is, and wanting to have the first time for people to see it, interact with it. I think it's going to need some more meetings and maybe steering. But my thought was, what do we do with this, right? Do we accept the charge that this needs a champion? Do we agree that some of these items actually are really top priority for the IPRTF? So if that makes sense, I think we're going to need more members to see it. Probably an opportunity to give feedback, maybe via email. I do know we have quite a few people on vacation, and I think we might need some exposure to members over time. But I'm curious about what you think, and then Stephen, with the idea that the steering committee of IPRTF look at this formally in some way in terms of adoption, partial adoption, it's something like that. So Stephen or Dan, if either of you have comments about those ideas.
Stephen, go ahead.
Well, I think the conversations so far are somewhat along the lines you set out, Mike, and that is that the SIM is over here in this subcommittee being discussed and was reviewed in a very superficial way yesterday in the whole task force meeting for the purpose of the task force adopting some update of the SIM to bring it current from what we did in 2019 and 2020. This is great work done in service of the SAC and the recommendations that will come out of that. But I also think that excuse me, the steering committee and the SAC planning team thought that there was some ownership called for out of the task force. So I think the plan is that it'll come back before the task force for its August meeting, hopefully having had further review, this kind of discussion. We may or may not be ready to act on it then, and I think that could be a recommendation coming out of this group. Or we could act on it in a way that made some of the tweaks, for instance, as Brian suggested, adding NAMI or encouraging public defender-based behavioral health specialists, as I was suggesting. We could make those changes. That could still be the task force's version of this SIM update. And the SAC could make whatever use they wanted of that. But I do think there are two tracks to go forward with. One is informing the SAC recommendations, and the other is laying out some parameters and some directions for future work from the task force. And I don't think that's tripping over our own feet. I think there's plenty to go around there, and so in that sense, I agree with Mike's point.
Okay, other committee members? Okay, I'll chime in real quick here. We're over time. I want to respect everyone's time, but I do want to try to set the table, so to speak, for the next behavioral health meeting. I think there's I have lots of questions on the BEGAT team's work, and in particular SUD stuff when it comes to fentanyl. I saw methamphetamine called out specifically under item 9, but I want to drill into the fentanyl issue that we're having here in our community. It's a big deal, and it's problematic. That being said, flying back up to 30,000 feet, I think we need to go over that work, identify priorities out of that committee's work, and then get that shipped over to the SAC. My understanding is that they're to make a recommendation, I think in November of this year. Correct me if I'm wrong, if anyone knows. But so we have a fairly shortened timeline to, I think, to work with them and to help them create a recommendation. So I'd like to drill into the work product that was shown here by Jackie today, and maybe do like a top 3 recommendations, or 3 to 5, or whatever the number is, so we can then get that over to the SAC. Any thoughts on that?
I think the next step, Dan, would be that this will come up at the next steering committee meeting for the task force. And I think that discussion will be around evaluating whether the timeline we had hypothesized is actually realistic. Do we need more time to discuss the kinds of questions you were just raising from a task force perspective? And then the steering committee will decide how that goes on the task force side of things.
Okay.
But I think the points you're making are well thought out.
Jill?
Thank you. Just as a reminder, the steering committee has decided to dedicate most of the August full task force meeting to this item, to the
Okay.
SIM.
Okay. Yeah, I just, whether it lives here or there, it doesn't really matter to me. I just want to make sure that we drill into it and make a good recommendation to SAC. So we are 6 minutes over time. Are there any other items for discussion, other business here today? Okay, seeing none. Jill, we don't have any public members here today, is that correct?
That's correct.
Okay. Pardon me. Okay, so seeing no other business and seeing no other public comment, I'll go ahead and adjourn the meeting. Thanks, everyone, and have a good rest of your day.